dressing. So I'm going to go visit with the patient here. Knock, knock. Hi there, I'm Lee Allen. I'm your nurse today. Looks like the doctor's ordered a wound dressing for you. We're going to get that cleaned up for you. How are you feeling?
I'm in some pain.
Okay. On a scale of 0 to 10, where's your pain at?
About an 8.
Okay. All right. Well, we're going to get you some medication. Can you verify your name and date of birth for me?
Courtney Smith, 6'2" of 88.
Perfect. All right. Well, I'm going to go grab the medicine here real quick. All right. Got the medicine. Give that to you. We're going to wait about 30 minutes here. Get that going. Okay. 30 minutes have passed. How are you feeling now?
Much better.
Much better. All right. We're going to ask family to leave now. We're going to do a wound dressing on her, so we'll call you back in when we're all done. Okay, and wash my hands here. All right. Just going to get this rolled back. Raise up your bed here. And put on some gloves, non-sterile gloves. All right, I'm gonna remove the tape here. Being sure to pull back so it doesn't stick to her skin there. If it does stick and we're having troubles, then we would use some saline to help move that along so it's not painful for her. Okay. Oh, and we're also going to put the blue pads on her as well at this point. So we've got those under her now. We'll do that before we start removing. Alright, we've got this untaped here. Go ahead and grab that. I'm going to look for type, amount, color, and odor there. And then I would record that when I'm all done with the procedure and get that in the biohazard bag. As well as I'm going to remove this JP drainage dressing here. Okay. Alright. I'm going to open my sterile gauze here and I would add some saline. Get a couple of them at a time here so we can get this cleaned up. And go away from her. New ones each time there. And I will also do one for the JP drain here. Around it there. Alright. Take off my gloves here. Wash my hands. And put on some new gloves here. And we're going to do a culture real quick, and I have new gloves on. Okay. Alright. Put that in there. We're going to put that in a biohazard bag and send that off to lab with patient's name, date of birth, my initials, and the type of culture it was. Okay. Send that off to lab. Wash my hands again, and now we're going to start with the sterile field. Put my gown and gloves on. Okay. And I would put my mask on, but I'll keep that off just for recording purposes. passages, and I'm gonna put this over here and I'm gonna drop the rest into that sterile field there. And now I'll put my sterile gloves on. All right. So we're gonna put the gauze on now over the wound. Pad there. And tape that, secure that down. Alright, and then I'm going to go ahead and work on my JP tube here. I'm going to strip it and then get my dressing on there. Tape that down as well. Now I'm going to get my cup ready so I can empty out my tube. So I will stripped it. I'm going to open it up and empty it, and then grab my alcohol pad here. Not drop that in there. Clean out my thing, empty, and then secure. Alright. And then I'll note this for documented as output. Alright, and now I will get the patient cleaned up here. Cover her back up here. Raise her bed, or lower her bed here, give her a call light. How are you doing with that procedure?
Great, thank you.
Alright. And I get out of my sterile field here and clean up. And then we'll get your family back in here shortly. Clean up, wash my hands here, and then I'm going to record everything, document the procedure, and we'll invite your family back in. And then I will also put a time and date on that dressing there so everybody else knows. And we'll invite the family back in. I'll get that documented.
Thank you.